One. Perfect. Okay, let's go. Hello and welcome to our second Ask a Nurse question and answer. My name is America and I'm the communications coordinator for Immunize Nevada. Immunize Nevada is a statewide nonprofit dedicated to promoting health and preventing disease. As we face a global health crisis, it's crucial that we take steps to protect our families and communities from preventable diseases. This week, we observe National Infant Immunization Week, which aims to highlight the importance of immunizations for children 2 years and younger. Staying up to date on immunizations during a pandemic can be difficult. To provide some clinical guidance on this crucial issue, we are pleased to be joined once again by registered nurse and Immunize Nevada intern Jaime.
Hello.
Hi. And you are in your car and you are at work, or where are you today?
I'm at work. Sometimes during a pandemic, your schedule gets changed. So I am at work on my break right now.
Well, thank you so much for taking the time to join us. We really appreciate it.
Mm-hmm. Not a problem.
We have some great questions for you today regarding immunizations, their safety, and whether or not to keep up to date with your well child visits during this time. So let's dive right in. Right now, should I be taking my child in for wellness visits or vaccines during COVID-19?
That's a good question. I know a lot of people are nervous about that right now, but the American Academy of Pediatrics and the CDC are still recommending that children get their routine vaccines. We don't want them getting behind on them. And there's a couple different reasons for that. Vaccines prevent numerous different infections, and we need to get the children their vaccines early so they can be safe from those vaccine preventable illnesses. And also, if they get those vaccine preventable illnesses, there's such a strain on our hospitals already that we don't want to be taking care of people who have measles. You know, it's a scary time to be in hospitals. We'd rather keep everyone home.
That's really good to have in mind right now. So why do they give so many vaccines at one time? I know sometimes it can be really difficult for parents to come into a well child visit and see that their child is scheduled to get 3 or 4 immunizations in the same visit. Why are so many given at one time?
Well, there's a lot of research behind vaccines, and they figured that the times that they give them is when the body's most able to receive the effect from them. So if you give them at 2 months, 4 months, 6 months, the child has a better, the effectiveness against the disease is better for the child than it would be if you didn't give all of them at the same. So that's why we give them in such a group. Now they do combine a lot of vaccines now, so it's not as many sticks, but it still does seem like a lot, but it's just because that's when your body is most able to make the antibodies for those diseases.
Right, so there is some scientific proof and evidence why we should give them. Perfect, that makes
sense.
Absolutely. All right, so I know right now, obviously, Nevada has been hit hard by the stay-at-home order. Of course, it's in everyone's best interest, but our industries such as retail, restaurants, casinos have been hit hard with the order. There are a lot of people right now out of work, out of jobs, and unfortunately uninsured. Where can one take their child to get immunized if they don't have insurance right now?
Well, there's actually a federal program called Vaccines for Children. Any child who is uninsured, under the age of 19 or underinsured, which means their insurance doesn't cover routine vaccines, or if they're a Native Alaskan or a Native American, their vaccines can be provided for free from the Vaccines from Children's providers. We do have many, I'm going to say VFC, Vaccines for Children is VFC. We have many VFC providers in the state of Nevada. You can go to the county public health departments. They provide the vaccines for the VFC program. Sometimes there's a small fee for administration, but if you don't have the money for it, they'll still give you the vaccine. So don't worry about that. If you have zero money, your child can still get the vaccines on time if you go to one of those providers.
That's really great that they do have that program. I know a lot of parents right now have questions on where to go, and it's great that that's available. And of course, that website for parents is at vfcnevada.org.
Yes.
All right, switching gears a little bit. I know a lot of folks, say that natural immunity is best. Is it better for my child to get immunity from having the measles or chickenpox instead of getting a vaccine?
Well, if your child has the measles or the chickenpox, they will have the immunity against it before. But the good thing with vaccines is we give the minimal amount needed for the antibodies to be in your body without the major side effects that having the illness can lead to. So, for example, measles can cause swelling in your brain sometimes, but the vaccine does not cause that. So you're preventing side effects that could happen with the disease from getting the vaccine in a smaller amount than you would get naturally.
That seems like a lot better than,
Yeah.
having the full-blown disease. That's good to know. So a lot of folks may not exactly know what immunizations they need to get for their child. Where can one find out about what immunizations their child needs?
Well, in the state of Nevada, there is a great website called WebIZ, and you can look up all of your vaccines on that website. In the state of Nevada, it's actually mandated that all vaccines are put into that database. So if your child's had a vaccine anywhere in the state of Nevada, it's in there. And then on the bottom of the printout, it actually tells you what they're due for or what they're overdue for. So that's a good way to know if they're up to date, if they need new vaccines for school before the school year starts, or if they need their routine vaccines if they're a little behind. So that's WebIZ, and there's a public portal that you can go on and you can look up your own child's vaccinations.
That's great. Actually, we do have that link on our website. It's under Nevada WebIZ, and you can look up your child's immunization record from there. So a question we get a lot as folks doing outreach in our communities, and I'm sure you get as a nurse, it's totally natural for parents to have this question. Are vaccines safe? Could you shed a little bit of light on just the kind of scientific and medical community's opinion on the safety of vaccines?
Vaccines are considered very safe. They actually have a lot of research done on them before they're given to the general public. It takes years for a vaccine to get onto our schedule. They are rigorously tested before they're routinely given to people. And we've been giving some of these vaccines for a very long time, and we know what their side effect profile is. And we found that their side effect profile is far better than getting the diseases. So vaccines are safe to get, with some caveats if you have allergies to the actual vaccine, or if you have an underlying condition, but your doctor would tell you if you're not safe to get those. For the majority of people, vaccines are probably the safest medication that you're going to get because it's been studied and rigorously tested before they give it to the public.
Wonderful. Thank you for answering that very common question. And it's understandable. Parents want to do the very best for their kids, and it's totally understandable they have that question about the vaccines. Another question we get a lot, especially maybe during National Infant Immunization Week, when we're looking at the schedule, it seems sometimes that there are a lot of vaccines out there. Why does my baby need to get so many vaccines?
Well, like I said earlier, the reason that I give so many at the same time is because that's when your body's naturally more able to make bodies. But also your child's getting more vaccines than you did because we have more vaccines now. So we are actually able to, instead of kids going to the school with, kids going to the hospital with preventable diseases like a Hib pneumonia, we have a vaccine for that now. Instead of kids getting chickenpox and possibly having side effects from that, we have a vaccine for that now. We have vaccines for pneumonia. So we just have more now to help protect our children. So while it does seem like a lot more than we got when we were kids, it's because they're not getting the diseases that we had when we were kids.
That sounds like a great thing, actually. Yeah. I wonder, vaccines are considered one of the best and most amazing inventions of the 20th century as far as medicine goes.
Yes.
One last question, and it's a question we do typically get. We obviously understand the safety importance and the advantages one gets when you breastfeed your child. We understand, that there have been studies that establish that to be a great course and a great thing for young babies. Do breastfed babies need to get vaccinated, or does breast milk prevent diseases, or can you shed a little bit of light of that?
Yeah, breast milk is a wonderful thing to give your baby. It does have a lot of antibiotics to help your baby's immunity up to a point. However, kids still need to get vaccinated because the mom doesn't have enough of those antibodies to give enough of the response for those diseases to the children. So just like even though the mom has some antibodies towards a cold, the kid's still going to get the cold. The mom has some antibodies against measles, let's say, but the child's still going to need to get their vaccines at 12 years old against measles, mumps, and rubella. And some of the things that they give vaccines for are just for kids. You know, like an adult's not going to have problems with pertussis, which is whooping cough, but a child is going to have problems with that. So that's why we give them the vaccine.
All right, that's all the questions we have today. Thank you so much, Jamie, for taking the time out of your busy schedule to answer our questions. We remind all of you to visit our website at immunizenevada.org for answers to questions about vaccines, as well as other resources you need to stay healthy. We encourage everyone right now to stay up to date on their immunizations to help protect our communities. Thanks again, Jamie.
Yes, thank you for having me.
Remember, stay safe, stay healthy, and stay home for Nevada.
Mm-hmm.